So it sounds like obviously allergies can be a big part of a kid's childhood if they have asthma. Um, how can parents actually know what their children might be triggered by?
Well, I think it's very important to start with a good history done by a medical professional where you try to get the history of exposure to some of these allergens, but the history isn't a perfect tool, and people's memories and assumptions don't always give you all the information you need. So it's almost always good to do testing to determine allergic triggers for all but perhaps the very most mild asthmatics. If you have someone who has very mild asthma and only occasionally needs to use an inhaler and might go weeks and months and be fine, those patients arguably might not need allergy testing, but anybody who uses asthma medication on a regular basis, certainly anybody who uses a controller medicine, and we'll talk in a second here more about what's meant by a controller medicine, all of those patients are candidates for testing, and they'll be much better controlled with regard to their asthma if their allergic triggers, if they have them, are identified and their exposures controlled. So a minute ago I used the term controller medication, and these are the kinds of medications that are typically taken daily by patients to try to keep their asthma under control rather than having symptoms on a regular basis or even having exacerbations where they have severe attacks of symptoms. So any patients who have moderate to severe asthma or persistent asthma wind up with, if they're getting good care on a controller medicine or even perhaps more than one, that they use every day to try to keep their asthma under control. And obviously it's difficult to use daily medications, so one way in which testing for allergic triggers is important is that if you identify an asthmatic patient's allergic triggers and reduce exposures to those, then the patients might need less medication to be under control. They might have fewer exacerbations where they get those attacks of symptoms that are very troublesome. And they might have more symptom-free days, more days without missing school or work or being troubled by symptoms when they're at school or work. So really a good medication program goes hand in hand for allergic asthmatics with the testing that identifies their triggers and a good program to reduce their exposure to those triggers.